Grüezi ragazzi, willkommen e bienvenue to Cannabis Scienza's LinkedIn Live for this week. To those of you joining us live, thank you very much for being here with us today. And for those of you who will be checking out the recording at a later time, also a big thank you to you for checking us out. We hope that you enjoy the session today and that you perhaps leave having learned something new. And before we get started, just a quick overview about Cannabis Scienza. Cannabis Scienza aims to combat the bottlenecks of the medical cannabis industry using the power of education and through training healthcare professionals on the effective use of cannabinoid medicines, and in doing so, doing our part to increasing the access to medical cannabis for patients worldwide. Here at the moment, you can see an overview of our services, as well as a QR code that you can scan if you'd like to get in touch with us. And another thing that we would just like to bring your attention to, something that we've been working very hard on. It's our principles of clinical cannabinology. Here you see a short overview of the chapters, which covers everything from the endocannabinoid system to the pathologies that can benefit from medical cannabis, as well as an overview of the different product and regulatory landscapes across Europe. And if you're interested in learning more about the handbook or even supporting or sponsoring the handbook, please feel free to scan the QR code you have on your screen. And now, without further ado, uh, the topic for today's LinkedIn Live is medical cannabis in Italy. And we are very pleased to have with us today Marco Tornelli. And on that note, I'm going to pass it over to my friend and colleague, Fabio Turco, CSO for Cannabis Scienza. And Marco, thank you very much to you. Gentlemen, please take it away.
Okay, thank you, Bishan, for this introduction. Good afternoon to you all, and welcome back to Cannabis Sciences live on LinkedIn. As Bishan was saying, today's topic is medical cannabis in Italy. We choose this topic, because medical cannabis has been regulated in Italy for almost 10 years. So today we have the opportunity to dissect some aspect of the current regulatory process, and this could also provide food for thoughts for comparisons with other European legislation. I look forward to discussing this with our guest, Marco Ternelli. Moreover, Hi, Marco. Moreover, Marco is a pharmacist and an expert in galenic preparation. So we will also discuss about the extraction methods for medical cannabis. Did Marco co-authored a publication regarding innovative methods for preparing medical cannabis oil? But before starting, let's take a closer look at our guest today. So, Marco, again, good afternoon. And could you please tell us a little bit more about yourself and your background?
Yeah, sure. As you said, it's absolutely clear at this point. I'm a pharmacist. I'm a compounding pharmacist, meaning that I'm spending my life, my working life in compounding medicine. I'm not the typical pharmacist that sells the pre-made by pharmaceutical industries drugs. I graduated almost 16 years old at the University of Modena Reggio Emilia in Italy, and I always compounded medications since 2006. Of course, medical cannabis only went legal in 2013. Before that, and obviously keep going, I compounded every other pharmaceutical forms, not with medical cannabis. But then in 2013, cannabis became legal in Italy, and starting from that point, nowadays, I'm compounding a lot of different pharmaceutical form with medical cannabis, and that's who I am.
Okay, thank you. And Marco, how did you get into the world of cannabis and medical cannabis?
If you mean how it hit that the magic happened, I have an episode. It's an episode actually that I intend as the milestone that decided my destiny with medical cannabis. I was attending a conference meeting right at the beginning of the 2013 when medical cannabis was about to become legal. It wasn't yet, but we knew that there was a decree on the way. In this meeting, there was a doctor, a physician, who was already prescribing, using importations of medical cannabis. He was prescribing medical cannabis to some patients, and he said something like, I'm about to talk you guys about something you all know, and you have heard of it. It's well known in all over the world. It's dangerous. It's scientific proof that can cause damages to the cardiovascular system. And I brought some free samples today to make you try if you want. At that point, I said, no, I can't believe this guy, this physician, has brought some medical cannabis here. And he took out from a box what it was actually a can of Nutella. Okay. Something happened in my synapses because a few moments before I was absolutely convinced he was talking of the dangers in marijuana. Let's call it like an illegal drug. And I was popped out. I was so surprised to think, no, I have a big prejudice. This is a medicine. This is going to be a medicine. Why I'm as a pharmacist considering it like an illicit, an illegal drug. From that moment on, I understood that, yes, it's a medicine now. Let's treat it as a medicine. And that the adventure began.
Well, so you discovered that it's not so dangerous as people was saying, but it's a product that is useful to treat a lot of medical conditions. Right.
Correct.
Well, now let's talk about your role as a pharmacist and also our role as Cannabis Scienza, because we are a company focused on education of medical cannabis. I was reading a review published last year in which it stated that even though pharmacists are generally comfortable with dispensing medical cannabis, they still require further education to do so as safely and effectively as possible. Do you agree with this? Is this in line with the current Italian and European scenario?
I absolutely agree. As for Italy, in Italy, every pharmacist can compound medical cannabis or whatever else. Speaking of medical cannabis, there is no formation at the university. There is no teaching at the university. A pharmacist can decide one day, just waking up and deciding that, yeah, I never compounded in my life. I never treated with marijuana, with medical cannabis, but today I want to do it. Doesn't matter if I have know-how, the expertise. I'm a pharmacist, and the Italian law allows me to do it. That's something that, yeah, from my point of view, has more side effect, negative effects that the positive. Has more cons than pros. Because if you know what you're doing, yeah, you can bring a lot of benefits to the patient. If you don't, there are a lot of issues here that I can see. Most of all, you wouldn't be capable to do the caregiver, to be the caregiver that you should be, because a pharmacist is not just the one who, here, take, this is your bag of medical cannabis, this is your oil, this is your sachet, whatever, of medical cannabis. It's the one that explains a lot about dosages, assumption, side effects. That because now after 10 years in Italy, all of this should be something that the physician should do. But actually it isn't. Most of the physicians don't prescribe it. And when they do, I'm speaking of a certain quota, not all, obviously, not the whole doctor category. When they do, they don't have the idea what they are doing. For example, just basically, they don't even know how to prescribe it, because the legislation, the law about galenic compoundings, galenic prescriptions is different from the pre-made industrial prescription. So, in conclusion, yeah, I agree with the statement, but moreover, a pharmacist, Italian, or I could say a European, must have has an important role, but must study and practice and increase his know-how as much as possible.
Yeah, we also agree with you, and we are here for this aim to bring education on a higher level in the field of medical cannabis. Okay, how you said before, medical cannabis in Italy is allowed since almost 10 years. Now, from the point of view of a pharmacist, how do you rate this law? Is it promoted or flanked, according to your opinion?
Oh, I've seen worse. Meaning that we have one single law. It's the so-called Decree Lorenzin, the name of the foreign minister of health at the time, and it's dated 9/11/2015, meaning time has passed. If you know what I mean medical cannabis, now it's 2023. At the time, 2015, an entire era has passed in research, knowledge, techniques, but the law is now, it's old. At the time, it wasn't so bad. Even also considering that half of the decree, it was just a collection of different pieces of different rules put it together to guide the prescription, production, cultivation of medical cannabis. It's aged. It's an aged law, because it's, as I said, it's still just to make you example, it's still recommend as a primary way of administration the herbal an herbal tisane, for example, infusion. But personally, I think it's one of the worst. And it says that, okay, if infusion doesn't work, let's switch to the vaporization, something that most of the patient can't afford economically, or just for the stigma, or just for the idea of vaporizing and vaping medical cannabis. All the word of the extract is not considered, even if not even small paragraph, when it says there are some so-called extract, not well identified extract, and that's it. So it was a quite good, a decent law in 2015. Now it needs to be renewed a little, update, exactly.
Yeah. Moreover, for people that comes from outside Italy, in Italy we have just one regulation on the national land, but every region in Italy have different application of this law. So maybe it can happen that a patient from a region can find a kind of product, or it can be prescribed for a kind of pathology, but it is different for in other region. So from the point of view of patients, do you think it's easy or not for an Italian patient to access medical cannabis with the current regulation?
We must distinguish, first of all, if you are talking of a payment prescription, when it's the patient that pays in the pharmacy to get the medical cannabis, or when it's reimbursed by the regional health system. The first case, when it's the patient that pays, the law, it's the same in the whole country. So it should, theoretically, in theory, should be very easy, because you could go to your doctors, your personal physician, he would prescribe medical cannabis, you go to the pharmacy, and that's it, and you get the medical cannabis. In reality, there are two big obstacles. One I mentioned before. It is a physician. My personal rate is about 70% of Italian doctors don't prescribe medical cannabis because they don't know it. They don't know. Maybe they want to prescribe it, but they don't know how to do it, or for them it's the evil, the pure evil. No, so stay away from that. And that's the first obstacle. The second obstacle is availability. We often running big shortage of medical cannabis. The last was in 2022. We had almost 6 months of the year with a very poor availability of medical cannabis. That said, the second option, when the health system runs into, I mean, it's the health national system or regional system that reimburse medical cannabis. There's an obstacle more that is, you were saying it, it's the different, there are different therapeutic indication, different possibilities. So you can have a patient that say lives in a region when he can have access for free to medical cannabis. The same patient with the same disease in another region maybe must pay for it, and that's not fair based even on our constitution.
Yes, of course, this is not fair at all because this kind of regulation can create different class of citizen based just only on the place where they live. So maybe this is a thing that could be changed. Bishan, you want to ask something?
Yes, I wanted to ask. I heard that in Italy, the military also plays some role. So, but could you perhaps just briefly describe the role of the military in the medical cannabis industry in Italy, please?
Yeah. Long story short, they are for now. I mean, nowadays, they are the only company. It's a public company authorized to cultivate medical cannabis in Italy. They produce about the 5%. I estimate 5%. If it's not 5, can be 4, can be 6, but these are the numbers of the yearly need. We Italians, we decided to give to the military the role of cultivating medical cannabis because they are a public facility already involved in making the production of orphan drugs. So that's why at the time it was decided to give to them the cultivation. At the time, we depend exclusively on Dutch, so we import from Dutch all our Italian need. That wasn't enough. When I say at the time, I mean 2014, 2015. So we called the army for help. Let's say so. The problem is they can only the official quota of their production is about 100 kilograms, 40 kilograms, 80 kilograms in the last year, when our estimated quota is around 3 tons, 3,000 kilograms. So their role for now it's very marginal, is very limited by that, and that's why in Italy we are moving to open the market to private, assigning extra licenses, but it's a process that will endure for many years.
Yeah. Very, very interesting. Thank you. I also didn't know the role that the military already played even before cannabis was a topic in the, let's say, there being the overlap with the pharmacy world. Thank you, and thank you, Fabio, for letting me jump in. Please continue.
Yes, of course. I was thinking that maybe for someone it can be an oxymoron that the army produce cannabis, but this is Italy also.
Yeah, this is it. That's the best answer I usually used to say. This is Italy. Welcome to Italy.
Welcome to Italy. Yes. So now let's talk about your expertise as a galenic pharmacist. As I was saying before, a publication you co-authored discussed innovative methods for preparing medical cannabis oil. Can you explain what are the strengths of the method you developed compared to other methods for extracting medical cannabis?
Yeah. Let's say I see 2 points of strength, and these are the fact that with this method you can preserve as much as you can as much terpenes as possible compared to the other previous method of extractions, because I think that and not the only one, a full spectrum oil, speaking directly of terpenes, it's what differentiate a compounded extract made in a pharmacy compared to an isolated product that maybe a pharmaceutical industry in the future could send on the market. And the fact that it allows to standardize the oil. And with standardize the oil, I mean, it allows the pharmacist to always stabilize the same identical quantity of THC and or CBD in the extract. Doesn't matter if you compound today with a flower batch with 20% of THC, and the day after you compound with the same oil with 21.3 THC, and the day after tomorrow you compound the same oil with 19.7. You always decide that your oil must have just made up 15 milligrams each for every milliliters. Once that's decided with this methodic, you can obtain always the same identical THC level inside the oil. And that's a very useful tip for both the patient that doesn't have to change the number of drops every time he buys a new batch, and for the doctor that he already knows at the time he's filling the prescription what the dosage will be, and so he can make his own calculation about the dosage, how many drops, and simplifies a lot of the life, and for as much as possible avoid the adverse drug reaction we used to have in the past when the patient bought the first batch and he had a certain ratio or a level of THC corresponding to 20 drops. Then in the next batch, those 20 drops had to be adjusted to 24, but the patient maybe doesn't remember when the first time he takes 24, but then he reminds, no, it was 20. And then maybe the third batch, he has to lower and go back to 17 because the batch has an higher content of THC. I mean, I don't know if I made myself clear. If I don't, maybe that's the point. It would be very difficult for the patient to keep his medication right and correct, and maybe the adverse drug reaction couldn't come. So with this method, you at least remove this possibility.
Okay.
I think this is a common theme in many medical cannabis markets. You can explain certain intricacies of the market, and it makes you question how they came to create these regulations. But this is why we do what we do.
No, fair enough.
Yeah. Moreover, I think you have been clear in your explanation, because basically, so you standardize the content of THC and CBD in the extraction. But I was wondering, you also standardize the content of terpenes?
No, because to standardize the cannabinoids, THC and CBD, you need to have an HPLC, for example, directly into your lab, into your pharmacy. Technically, you could try at least standardizing the terpenes using a gas chromatographer, but it's a totally different machine, and terpenes are not standardized in the original certificate of analysis. So what I said before, I try to keep all the higher quantity of terpenes compared to the previous methodic we used to have and adopt in the lab, because most of them, of those previous and old methodics, were all focused on obtaining the higher THC ratios possible, with even if it meant cooking the oil, I mean burning the oil, or losing all the terpenes of most of all. So what we do with this methodic is to save all the terpene present, but not standardize them.
Okay, thank you for your explanation. Now another question. In terms of storing and using a cannabis product, whether extracts or cannabis floss, how would you advise patients to properly handle cannabis products?
It depends by the pharmaceutical form. Generally, if it's a short storage, I mean the patient has a small quantity, is going to use in less than a month, and we are talking of sachets, bags, to make it an infusion or vaporizing it. Normal temperature, room temperature is more than enough. If a patient has a bigger quantity of medical cannabis that can last different months, we usually advise to store in the refrigerator at -20 the most of the quantity, and take them out a few days before the consumption. If we are talking of extract, we always advise to, and whether we warn all the patient to keep them in the fridge, so between 2 and 8 degrees Celsius, because from what we see, from what the technology, depending on the technology, the kind of oil, the process, and everything, there's a quick degradation of cannabinoids, but that doesn't happen if you keep the oil in the fridge, or if it happens very slowly. So basically, to sum up, in the refrigerator, you must store a big quantity of flowers. And in the fridge, you must store and always keep stored the oil, the extract, to prevent the degradation of the cannabinoids in itself.
Okay, and how long can you store cannabis floss in the refrigerator?
Cannabis floss, the flowers, there are studies that declare it varies from 1 to 2 years if stored at -20. That's different from -18. Seems only 2 degrees of difference, but it's different. For the oil, it depends by the methodic. The methodic we discussed before, at least it guarantees 6 months of stability, shelf life.
Okay, thank you. Now, just a last question that comes from our audience, from Dr. Biagio Maceri. He's asking, what do you think about the solventless extraction procedure? Is it possible to apply this technology in the pharmacy?
It would be a good extraction. Technically, it's possible to apply it to a pharmacy. Thing is, a pharmacist can only do all this kind of extraction if there is a prescription that tells him to do it. So you must convince a doctor, a physician, to prescribe into a prescription to use a solventless extraction. And the thing is, in Italy, in a pharmacy, you only work very, very, very small or tiny batches, meaning 5 grams. Or you collect a lot of similar or identical prescription, all requiring the solventless extraction. Otherwise, you could find yourself extracting 1, 2, 3, 4, 5 grams, and it's impossible to practice a quality and effective solventless extraction in a small quantity like that.
Okay, so it's up to the doctor to choose one or another method.
The doctor actually could leave you on your own. If you requiring, do whatever you want. It's a latent phrase. I'm not gonna report here, but the problem then would it be having enough material to work, because it's a controlled substance, so you can't use it, take it freely, making your own experiment. The thing is, yeah, you have only 3 grams to make a solvent extraction, and yeah, the outcome wouldn't be, it's not worth it.
On that note, guys, we have reached the end of our live stream for today. I mean, there's so many other points that we wanted to also talk on, so I think that we probably have to schedule another session to continue. I just wanted to point out there was one more comment from Christina in the audience, and that was, if I may add a storage tip for room temperature, keep in dark colored containers, not clear glass. Also, glass is superior to plastic. I see Marco and Fabio
totally agree.
shaking your head. Yeah. So thank you to Christina for that lovely addition to the comment. Also, shout out to Biagio. Thank you for your question. And Viola, always making sure that we are aware of the threats around us, the dangers of Nutella. So thank you very much for tuning in today, guys. If you don't already, please head over to Cannabis Scienza's LinkedIn page to give us a follow. And here is one more quick look at our services, as well as some information to our handbook. All of this stuff is available online. Marco, thank you very much. Fabio, it was a pleasure as always. And everybody in the audience, we'll see you next week. Thank you, guys.
Ciao. Goodbye.
Take care. Bye-bye.